Let us discuss on general overview of cancer. Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. If this spread is not controlled, it can result in death. It affects people of all ages, genders, and backgrounds, and remains one of the leading causes of death worldwide. While significant progress has been made in understanding, detecting, and treating cancer, it continues to pose a major challenge to global health systems. What is cancer at its core? Cancer is the result of changes, mutations in the DNA within cells. DNA contains instructions that tell cells how to grow, divide, and die. When mutations occur, they can disrupt normal cell function, causing cells to grow uncontrollably, avoid death, and form masses known as tumors. Some cancers form solid tumors like in the breast or lung, while others, such as leukemia, affect the blood and bone marrow and may not form tumors. Types of cancer. There are more than 100 types of cancer, generally classified based on the tissue or organ where they originate. Major categories include carcinomas. These are the most common and originate in the skin or tissues that line internal organs, example, breast, lung, prostate, colon. Sarcomas, arising from connective tissues such as bones, muscles, or cartilage. Leukemias, cancers of the blood-forming tissues, particularly the bone marrow and lymphatic system. Lymphomas and myelomas, cancers of the immune system. Central nervous system cancers, these begin in the brain and spinal cord. Each type of cancer can behave differently in terms of growth rate, spread, and response to treatment. Causes and risk factors. Cancer is caused by a combination of genetic, environmental, and lifestyle factors. While some cancers develop without a clear cause, many are linked to specific risk factors, including genetic predisposition. Some people inherit mutations that increase their risk of certain cancers, such as BRCA1 and BRCA2 for breast and ovarian cancer. Tobacco use, a leading cause of lung and many other cancers. Diet and physical activity. Poor diet, obesity, and lack of exercise contribute significantly to cancer risk. Exposure to carcinogens, chemicals like asbestos, radiation including UV rays, and certain viruses such as HPV and hepatitis B or C can lead to cancer. Age. The risk of most cancers increases with age due to accumulated cellular damage. It's important to note that having one or more risk factors doesn't guarantee a person will develop cancer, just as some people with no known risk factors can still be affected. Signs and symptoms. Cancer symptoms vary depending on the type, location, and stage of the disease. Common general symptoms include unexplained weight loss, fatigue, pain, skin changes, changes in bowel or bladder habits, persistent cough or trouble breathing, unusual bleeding or discharge, lumps or thickening in any part of the body. Early detection is crucial, as many cancers are more treatable in their initial stages. Diagnosis. Diagnosing cancer typically involves several steps. 1. Medical history and physical exam helps identify symptoms and potential risk factors. 2. Imaging tests, such as X-rays, CT scans, MRIs, or ultrasounds to detect abnormalities. 3. Biopsy, a sample of tissue is removed and examined under a microscope to confirm the presence of cancer. 4. Blood tests can detect markers associated with certain cancers. 5. Molecular testing identifies genetic mutations that may guide treatment decisions. Once cancer is confirmed, it is usually staged to determine its extent and whether it has spread to other parts of the body. Staging helps plan treatment and estimate prognosis. Treatment options. Cancer treatment varies depending on the type, location, and stage of the disease, as well as the patient's overall health. Common treatment methods include surgery, often used to remove localized tumors. Radiation therapy, uses high-energy rays to kill cancer cells or shrink tumors. Chemotherapy, involves drugs that kill fast-growing cells, including cancer cells. Immunotherapy, boosts the body's immune system to better recognize and attack cancer cells. Targeted therapy, focuses on specific molecules involved in cancer cell growth and survival. Hormone therapy, used for hormone-sensitive cancers like breast and prostate cancer. Stem cell transplant, particularly for blood-related cancers like leukemia and lymphoma. In many cases, a combination of therapies is used. Advances in personalized medicine now allow some treatments to be tailored to the individual's genetic makeup and the genetic characteristics of the tumor. Prevention. While not all cancers are preventable, many cases can be avoided through lifestyle changes and early detection. Key prevention strategies include avoiding tobacco, the single most effective way to prevent cancer. Maintaining a healthy diet and weight, a balanced diet rich in fruits, vegetables, and whole grains, and regular physical activity. Limiting alcohol consumption. Protecting skin from UV radiation, using sunscreen and avoiding tanning beds. Vaccination. Vaccines like HPV and hepatitis B can prevent virus-linked cancers. Regular screening, mammograms, pap smears, colonoscopies, and other tests can detect cancer early or prevent it by identifying precancerous changes. Public education and access to healthcare play essential roles in prevention efforts. Living with cancer. A cancer diagnosis is life-altering, affecting not only the patient but also their families and communities. Emotional, physical, and financial challenges are common. Advances in supportive care help patients manage symptoms, maintain quality of life, and cope with the stress of illness. Survivorship care monitoring for recurrence, managing long-term side effects, and promoting healthy living is an essential part of cancer care. Global burden and research. According to the World Health Organization (WHO), cancer is one of the leading causes of death globally, accounting for nearly 10 million deaths in 2020. The most common types include lung, breast, colorectal, prostate, skin, and stomach cancers. Global disparities in cancer care are striking. High-income countries tend to have better access to screening, early diagnosis, and advanced treatments, while low and middle-income countries often struggle with late-stage diagnoses and limited resources. Ongoing research aims to uncover new methods for prevention, diagnosis, and treatment. Areas of interest include cancer genomics, understanding the genetic basis of cancer to develop personalized therapies. Early detection, developing more sensitive and less invasive diagnostic tools. New drug development, including immunotherapies and small molecule inhibitors. Cancer vaccines, not only to prevent cancer, example, HPV vaccine, but also to treat it. Artificial intelligence and data science, helping identify patterns and improve decision-making in cancer care. Conclusion. Cancer remains a major public health issue with wide-ranging implications for individuals and societies. While its complexity makes it a formidable disease, continuous progress in science, medicine, and public health is leading to better outcomes for many patients. Increased awareness, preventive strategies, early detection, and equitable access to care are essential in the global fight against cancer. With a collaborative approach involving healthcare professionals, researchers, governments, and communities, the goal of reducing the burden of cancer becomes increasingly attainable.